Good evening, everyone. Our team CBME Heroes are back with the second presentation with our facilitators, Dr. Parag sir and Dr. Praveen sir. We once again acknowledge greatly and sincerely Dr. Sanjay Bedi sir for bringing us together, and we are here with nearing towards the second session of the CBME course. We also thank Dr. Parag sir and Dr. Praveen sir for having contributed enormously in our learning and preparation for the work. This is our heroes team. Hope we had a detailed introduction in the session 1. I will quickly just read out the names of our team for a quick glance. Myself, Dr. Maltesh, Dr. Nishant sir, Dr. Tilak sir, Dr. Nikhil, Dr. Ankita ma'am, Dr. Fazila ma'am, Dr. Mitasha ma'am, Dr. Shaili madam, Dr. Harsh sir, Dr. Amruta madam, Dr. Mary, Dr. Rujul, Dr. Sudha Kumari, Dr. Mulik, Dr. Goel, Dr. Amit, Dr. Piyush, Dr. Achyut, and Dr. Ritruk. So hope Heroes has been able to manage both COVID-19 and medical education, especially the CBME course well. So here is a quick overview of what we present for today. We have 4 sections. Looking at the previous presentations, we thought of elaborating some aspects which has been less dealt or not dealt in detail. So we thought that first let us discuss something about workplace based assessments. That is, for our group it is assigned task for interns, and secondly we will be discussing something about electives, which has been again done in a detailed manner by our group members. Hope you will enjoy learning from it as well as discussing with us. Section 3 is once again logbook, which is designed by our group member. So hope we will look into it and suggest us any changes further. Lastly, we have reversed the order. Lastly, we will come up with assessment of knowledge. Though last but not the least, we will look into the questions framed by our group, and please feel free to comment and discuss so that we learn better out of the discussions. So apologize because I will be shifting from the presentation to the PDF documents, because we felt that especially the first section 1 and section 2 have been a detailed one which has been already put up in Google Classroom. So I posted a little late, sorry for that. But now I will be moving on to the section 1, and I invite Dr. Ankita ma'am to present the workplace based assessment for interns. So here we switch from PPT to PDF for a detailed presentation.
Good evening to one and all. I am Dr. Ankita, and I'll be discussing the workplace assessment for an intern. The task assigned to us was conduction of a workplace assessment for an intern, and here we decided to undertake health education session assessment, which is a common thing which is expected of a community medicine person who has done his or her internship under our department. And since they will be undergoing this regularly, health education session in the health training centers, we thought of designing a workplace assessment for them. So the competency here addressed is evaluation or the demonstration of a health education program. So this domain is skill and level is shows how. The prerequisites is the individual should be competent in methods of health education, methods of organizing a health education at individual, family, and community settings, and also some part of effective communication role as prescribed by the competencies mentioned here. The certification requirements, since it's going to be a regular sort of an event which is going to be held at our rural and urban training centers, we decided to have 2 sessions in the urban health center, 2 sessions in the rural health center for the certification of an individual to be competent. And after this, at each of these centers per session, they are expected to have at least 60% of the expected marks, which I will be discussing in the coming few pages. So the remedial session we have planned is 1 per health training center. So a total of 6, maximum of 6 health education sessions will be conducted. And for this, we have designed our own tool based on certain parameters. So coming to the planning of the health education session, we have divided the health education session evaluation into 3 parts. One is the ability of the intern to conduct a health education session on the given topic. So it has about 5 parameters. I'll be discussing that a little bit in detail in the coming few pages. Then we are going to we are going to assess them on communication skills and organizational skills. So 3 domains, the skill of organizing a health education program will be assessed in these 3 domains. For the beginning of this session, the individual teams or the interns posted at that rural or urban health center are expected to fill something called a session preparation plan. So the session preparation plan is to be filled by the one of the interns in that interns group, and has to be submitted at least 2 days before the health education session is conducted. So it has some basic data on date, session number, where is it planned, how much is the or how many are the expected audience, who are the people who are conducting this health education session, who is going to be the internal preceptor, on what topic they are going to do, what are the specific learning objectives, and the subtopics under each of this health education session, with the intern's name and what sort of audiovisual aids will be used by that individual, and how much time approximately this individual would require to deliver the health education session. This has to be submitted to the internal preceptor. This internal preceptor can be the health education supervisor, who could be an assistant professor of the Department of Community Medicine, or the medical officer of that particular health center. So once this health education session plan is done, the interns will deliver the health education session on that particular day for that particular topic. So at that time, each of the intern will have to will be evaluated by the internal preceptor using this particular checklist. Some of the details, as you can see, are repeated from the session planning health education session planning checklist. So I will not go into that. I will go into the assessment of the health education session by the internal preceptor. As I spoke earlier, the 3 domains, that is ability to conduct a health education session, communication skills, and organization skills, will be assessed by this internal preceptor. So we have about 12 domains, of which the maximum marks per domain is about 2, for various sort of levels that an individual will present the health education session. So for the first session, we had uh, health education material, where the individual gives an approval at least 1 day prior before the session. And so this, if they come before 1 day and they get an approval, they are given 2 marks. Similarly, if they are on the day of the session with enough time for making changes or corrections, they will be given 1 mark. And if there is no such time which they can no time that there is for corrections or suggestions, they will be allotted 0 marks. The way they engage the audience, whether they do it actively or when prompted, or do not engage the audience at all, will be awarded 2, 1, and 0 marks respectively. The type of audiovisual aid used, whether it was appropriate for the audience. If it is a largely large gathering and with a fairly constant supply of electricity, they can use LCD. So that way, if it is a smaller gathering, things like flip chart or something can be used. The audiovisual aids which are used to deliver this health education also should be appropriate. Time taken, if they have maintained the time, they get 2 marks. If they have exceeded the time, but by less than 10 minutes, they are given 1 mark. And if they have exceeded the time allotted by more than 10 minutes, then they are given 0 marks. This is a surrogate marker for them, so that they will to see whether their delivery of the health session is according to the allocated time as per their session planning checklist. Innovative methods used also will be given extra marks if they are going to use role play or some videos that they prepare in the local language, or any participatory games, or any sort of an innovative method will be given 2 marks. If they are going to use already available videos, it may be in English or any other language which is not a locally prepared one. If they are going to use that, but they are going to translate it for the local for the audience, then they will be given 1 mark. And if they're only going to show the video and or use one type of health education material and not put any effort into translating to the audience, they'll be awarded 0 marks. After this, we are also going to assess them on the points that they cover. So the health education session should be such a way that it will be tailor made to the social and cultural norms of the audience. And if relevant points are covered for that particular audience, they are given 2 marks. If some of the relevant points are covered, then they're given 50% of the 1 mark, and few or none of the relevant points are covered, they are given 0 marks. So these are the assessment for the first part. Second, we are going to talk about the assessment in communication skills. If they use a language is understandable by majority of the audience, then they're given 2 marks. If they are using a language on or audiovisual aids which are understood by some percentage of the audience, say 40 to 90%, then it is 1 mark. And if it is a spoken language and audiovisual aids which is understood by very few members of the audience, then it is given 0 marks. The other two things that we are going to look at in communication skill is whether they provide an opportunity to the audience to pose questions and their ability to answer those questions. So if they actively ask the questions, then to ask the audience or participants to pose questions or doubts for the clarification on the topic, they're given 2 marks. And if they're going to ask such questions only after being prompted by the health education supervisor, then they're given 1 mark. And if they do not provide an opportunity even after being prompted by the health education supervisor, they're given 0 marks. After this, it is the ability of the individual to clarify the concepts and give a satisfactory answer to the questions posed by the participants. If they can confidently clarify, giving or provide suitable options or references for information, then they're given 2 marks. If they are taking the help of a supervisor for clarifying or provision of information by the questions asked by the audience, then it is 1 mark. And if they are unable to totally clarify any of the questions which is asked by the audience, then they are given 0 marks. For the organizational skills, the three things are assessed. This is mainly because of because our interns are also expected to be a team a leader and a health educator. These things have been added. So demonstration of teamwork, whether they are proactively and regularly contributing to the team, or they are offering some ideas, or they are offering no ideas, will be given 2, 1 and 0 marks. And their ability to work under supervision, that means they are coming prepared for the meetings or discussion with the supervisor with the required materials, and builds upon the ideas given by the supervisor. And if they are sometimes prepared and at least 50% of the time prepared with at least some ideas or materials for the session, then they're given 1 mark. And if they are almost never prepared for the materials or the meetings of the health education session, they will be given 0 marks. Next is their ability to work with peers. So if they are going to help their peers also in either preparation or designing or execution of health education, then they are given 2 marks. If they are going to complete only their part and sometimes helping or rarely helping their peers, they'll be given 1 mark. And if they are partially completing their own work, or they are able to not providing any sort of help for their peers in designing or preparing or executing the session, they'll be given 0 marks. So these are 12 sort of domains where we are going to assess the health education session. The maximum score for this is 12 into 2, 24, and the minimum certification we have kept as 60%. So they will have to score a minimum of 14 marks. So if it is less than 14, that is 0 to 13, they are below expectation and they will need a remedial session. So if it is in an urban health center, they will have to do one more session in the urban health center. And if it is rural health training center, they'll have to do it there. So looking at the feasibility, that can be planned. And if they get 14 to 20, that means it meets expectations, and more than 21, that means they are exceeding expectation. So I think next Dr. Maltesh will share his experiences in health education. So over to you, sir.
Yeah, thank you, madam. Madam has shared so far the workplace assessment plan prepared for interns. So my experience is not with intern actually. Madam has put up here as a prerequisite that the first year student should be familiar with all this health education. In fact, for 2019 batch CBME who are undergoing CBME curriculum, we had an opportunity of taking the sessions on health education and health communication. So in spite of making it just a theory large class, what we thought, because all the students were under lockdown at their own home, we took an interactive large teaching session with some of the quizzes placed in between. But we somehow felt that this teaching learning may not be complete if we do not know whether our students really understood the principles of health education and communication, and whether they are able to really apply this once they become like interns, what we are planning now. So like at the very beginning of their medical professional, we thought let us try something which we usually do for second year or third year, that is make them prepare something related to health education. So I will just share a one or two video very briefly. I will just skip through the video which has been prepared by our own students. uh, Only one has been uploaded. We restricted others because rather than uploading too much of information which may go uncleared by the faculty, this is just one session. We took the permission of the student also to share over to this larger group, and he was happy enough to share the permission and understand that we need permission of any person who creates the content. So I will just play.
You must do during this lockdown. Firstly, stay home, stay safe. If it is necessary to go out, then use face mask, clean your hands frequently with sanitizer or soap and water, and maintain social distancing. After returning home, change your dress and clean the fruits, vegetables, and other products with. So these people must stay in home comforting you against the disease-causing microorganisms. How to increase your immunity? At least during this lockdown, get enough sleep. Sleep and immunity are closely related. Maintain healthy weight. Exercise improves cardiovascular health and lowers blood pressure. It also protects against various diseases. Try to minimize stress. In olden days, there was lot of free time to think, but towards corona patients if they are in your surroundings.
Yeah, this was such one video which has been shared by our own student, prepared and shared. So I will also share one more just video, a quick.
Dr. Maltesh, you can increase the audio a little.
Yeah, it's not audible.
No. Mm.
Is it audible now?
Not very
Not
clearly.
audible.
Not very
Okay,
clearly.
I'll just quickly, I'll narrate it just quickly in 1 minute. Okay. So this is our student who took help of the own family member, sister. We also took the permission of his sister for sharing over here. She presumes the role of a Asha, and he is a medical officer who trains the Asha so that she will be in a better position to train others during COVID-19. So where she keeps on asking the question to the medical officer and gets clarity, and they have also seen that adequate precautions related to COVID-19 even during training are followed, which has to be continued during their workplace. So these were the videos which has been prepared. These they submitted to us. We screened them. We did not had such a comprehensive checklist as prepared by Dr. Ankita madam and her team. We just kept simple, whether the language was adequate, content was appropriate for the audience which they are planning, and whether they have took appropriate permissions from various agencies, if they have taken copyrighted materials, or and also whether the presentation style was adequate enough to consider it as a health education to the community or the audience which they choose. These were the few things, followed which they wrote their own reflections. We were actually surprised by the reflections they wrote. They understood what reflections is all about, because we had some brief training during their foundation course. What happened, so what next. They were understanding that they wrote what all they did, as well as what is learned out of that. Here the students has written they have learned various aspects of the communications required, especially for the health workers. This is the level of students understanding that, rather than studying the lecture class. Of course, that is the base level of knowledge which we all discuss. Building upon this, the students themselves have actually applied the principles of health communication and prepared their own video. And also they feel that in future this will help, where, see, the student has identified themselves that it will help them to counsel the people with COVID-19, and sometimes it may be other disease also. It will be definitely a needy, and in future it will help them to develop communication skills. I think that's what we are anticipating or expecting out of our CBME curriculum. So to fulfill that, one of the role of the IMG. So with this, I end my experience. We shared this experience because even during our discussion during the team, we were skeptical whether the students will really take up, because the checklist is so large, we can cut short it and make it brief, but whether students will reciprocate. I feel personally that yes, students do feel reciprocate with our own understandings and feelings if we prepare well ahead and give them adequate free hands also, as well as guidance. So we'll move on to next session, that is electives. I invite Dr. Mitasha ma'am to present the electives.
Thank you, Dr. Malatesh. Am I audible?
Yes ma'am, over to you.
Okay. So we will be presenting two electives here. The first one is Indian Red Cross Society posting, which will be obviously in the block 2 of the curriculum, and location will be the nearest Indian Red Cross Society branch, with the internal preceptor being the community medicine Professor Dr. Nishant, and one external preceptor that may be Chairman Health and First Aid Subcommittee of IRCS. So with the objectives of describing the functioning of IRCS, training the first medical responders, that is our students, to aid in time of emergencies, to demonstrate first aid in times of various emergencies, and organizing blood donation drive for the IRCS, and conducting health education sessions in line with the activity of IRCS. We move forward. Next, please. Next slide. With the prerequisites. So we can accommodate 5 students in this one elective, and with the knowledge of local language and various activities conducted by IRCS, the students can use the learning manual, that is first aid manual of the 7th edition is the latest one, and the following activities are expected out, that is to interact with the office bearers of the local chapter and understand their activities, attend the SERV training, that is social emergency response volunteer, and demonstrate the activities to you, first aid activities to youth Red Cross Society of various colleges, the degree colleges basically, and conduct health education sessions in the community regarding blood donation and disaster preparedness, and helping in organizing at least one blood donation drive in the community. So after all these activities, next slide, we expect our students to prepare a portfolio entries in form of reflections on learning experiences submitted at the end of the training to the internal preceptor, and reporting of various activities conducted, and letter of appreciation will be much more appreciated by or certificate from the IRCS branch, and daily log activities in the logbook is required. Assessment can be done in both formative and summative way. Formative is day-to-day participation. Their communication skills can be checked, the ability to organize the camps, the health education activities, the first aid activities. And summative by completion of the SERV training, presentation of the learning experiences at the IRCS. So this may motivate the students to start Youth Red Cross Society in the college if not already present. And with this, we move towards the second elective, that is the NCD clinic posting, obviously in the block 2. And this we have planned for a community health center clinic. An internal preceptor, obviously, and a community medicine consultant, and an external preceptor will be the SMO, obviously, of the CHC, or a medical officer of the CHC. With the objectives of identifying the risk factors and the diseases labeled as NCDs, screening the people for NCDs, diagnosing them, then suggesting appropriate first line treatment under supervision of MO, and counseling the families and the patient as per their needs, and conducting health education sessions in the community, inventory management under the supervision of pharmacists, and familiarizing with the reporting mechanism of NPCDCS program. We expect our students, next slide, at least a student's batch of 4 in one posting, with a knowledge of drugs used in NCD from pharmacology, and obviously a knowledge of local language to deal with the patients. Uh, the students will be participating in activities of orientation. Obviously, first day will be the orientation session, and then screening of apparently healthy attendance of the hospital, developing health education material on the any selected NCDs, and then conducting health education sessions with the patient, family, and community. We will also plan to meet with medical officers, CHC, district program officer, and narrate their perspectives, participating in reporting of activities under the NPCDCS, and presenting a case and a weekly report of the NPCDS program, other activities which are planned. Next slide. So we expect that the reflection on learning experience submitted at the end of the posting will be in the portfolio entries, and health education material developed will also be used, and daily log of patients examined and reports prepared will be entered in the logbook. Assessment will be through obviously the attendance, daily attendance that they are present there, logbook entries, and the case presentations which we'll be doing. So with this, I invite Dr. Nishant for section 3 logbook and move forward. Thank you.
Thank you, ma'am. Now we move on to the logbook. Just a minute.
Good evening, everyone. So we have devised this logbook activity based on one of the roles of Indian medical graduate. That is, the Indian medical graduate has to be a leader and member of a healthcare team and system with uh, uh, capabilities to collect, analyze, synthesize, and communicate the health data appropriately, and also as a professional should be accountable to patients, community, and profession. So one of the way of doing this is by proper management, and we have concentrated upon the inventory management technique in this assignment. So this is mainly for the MBBS phase 3 students. The time allocated is around 3 hours, and around 25 students, that is a small group students, can be tested during this. The competency addressed is CM 16.3, that is describe health management techniques, and sub competence is to perform selected inventory management technique in a simulated setting. Although according to the MCI document, this is a knowledge level domain with know-how level, we feel that management techniques are taught to the students only by community medicine. And as I mentioned before, they need to know about these so that they can guide their healthcare team once they probably become the medical officer or a part of a healthcare team. So the specific learning objectives of this session would be to perform the ABC FSN methods of inventory management in a simulated setting, and also perform the FIFO, that is the first in first out method of inventory management, again in a simulated setting. So the pre-session activity, they should have the theoretical knowledge of the inventory management techniques. And as we have mentioned in our first presentation, they should have visited the PHC or the USTC or the RSTC during the field visits, and they should have observed the inventory management techniques which is followed there. So during this session, as a follow-up of the previous sessions, they will perform the ABC FSN analysis of the various inventory list which is provided to the student, and also perform the FIFO management. The criteria for successful completion would be that the student should complete both the assigned activities with the score which is equivalent to the meets expectation level, and there is a numerical scoring which we'll be discussing subsequently. And documentation in the portfolio or annexure of the logbook would be the checklist and the scoring sheets which the student would have used, and which we would have used to assess the student. So if the student has not achieved the objectives, then the student is asked to revise the methods and re-attempt at the end or in a subsequent session. And clues may be provided to assist the student during the remedial session. So coming to the first exercise, so the entire group of 25 students, they'll be divided into two groups. So the first group will be doing the ABC FSN analysis. So we'll give them a list of the drugs which we would have had, and they will be asked to fill these tables. So this is the first table will be the items reviewed by the team, that is all the drugs, the surgical items, the disposables, and the dressing items. So they have to fill this table based on the list which is given to them. So frequency of ordering of the items, the annual units sold per year, the cost per unit, and the annual consumption value. So based on this, they will fill the next table, that is in decreasing order of the annual consumption value. And then after that, they will perform the ABC analysis. So this in this the percentage of annual units, and then categorize into ABC categories. So category being I mean 70% of the annual budget will be category A, 20% will be category B, and 10% will be category C. Also, based on how frequently an item is indented, they can also classify these items into fast moving, slow moving, and non moving items. So they'll fill the items in these columns appropriately. And finally, include the combine both of these and complete the ABC FSN matrix in this table. And finally, they have to write the inference as to whether the indenting is appropriate in that particular uh, PHC or UHTC. Again, it's in a simulated setting. So if the person can perform only a few steps and commits a lot of errors, then the mark given is 1. Level 2 will be the student can perform most of the steps with prompts and assistance and commits errors in a few steps. Level 3 can perform most of the steps independently with minimum prompts or assistance, and level 4 is the highest level of competency, that is can perform all these steps independently without any error. So this will be for the teacher to assess the student. The previous tables were for the student to fill up. So based on how the student does the activities and comes up with the inferences, this current table will be filled by the teacher. So based on this, the maximum marks will be 32 marks, and for the completion of the exercise, the student should score a minimum of 50% of the marks. So anything less than or equal to 15 marks will be below the expectation level. 16 to 27 will be meeting the expectations, and more than 28 will exceed the expectation. Similarly, based on the same list, the student can perform the first in first out method of the inventory management also. So the quantity, the expiry date, so based on this, the student has to arrange the list in a decreasing order. So the assessment method is similar. So level 1, level 2, level 3, and level 4, based on how independently the student can do it. So again, the previous table was for the student, and the assessment of the student is for the teacher. So for this activity, the maximum marks will be 16. So less than or equal to 7 will be below the expectation level. 8 to 12 will meet the expectations, and more than 13 is exceeding expectations. So based on this, the entry can be made. So the competency number, the name of the activity, the activities which the student has performed, date of the activity, whether it was the first attempt, repeat attempt, or remedial attempt. The numerical scoring is applicable here, and also the rating. What the preceptor decides whether it is completed, repeat, or remedial, and the initials of the preceptor, date, and any feedback that the learner needs to know from the teacher. So this is a sample of the list of items. So they have the tablets, there is the expiry date, the quantity, the rate of individual items, and the total amount. So we can also assess whether the student is using the rate of the individual items or the total amount of item for the ABC analysis. So a similar list will be given to the student, and based on this, the student should do the inventory management. I hand over the presentation to Dr. Maltesh.
Thank you, sir. Thank you for that presentation related to planning the logbook for especially the students who may be not trained in this particular activity in any other subject. So now we move on to section 4, assessment of knowledge. I invite Dr. Tilak to take over the presentation. Dr. Tilak,
Good evening.
over to you.
Yeah, thank you, Maltesh. Good evening, everyone. Coming to the assessment of knowledge part, we have been asked to do one long answer question, short answer, and then short SAQ and MCQ. So when coming to long answer question, so we try to give the one more instruction for the students, draw diagrams wherever necessary, and we took a competency that is 16.1, 16.2, and 16.3, which are related to health planning and planning cycle. Then, since this was an allotted competency for us, and the 16.1 says the purpose of planning, 16.2 about the planning cycle steps, and 16.3 about the management techniques. So all these are related to knowledge level and know-how level. So the marks allotted for long essay was 10 mark. Next slide, please. So this is a long question. As a new medical officer of a primary health center of a tribal area, you are planning to implement the mother and child health programs as per the needs of the community. So answer the following questions. So what is the importance of planning? Describe your plan of action using planning cycle. What is cost benefit and cost effective analysis? For each sub questions, we are given the divided marks. For first question 2 marks, for planning cycle with diagram model 6 marks, and to define cost benefit and cost effective analysis 2 mark. Next one is short notes. So for short note, we have taken the competency 18.2, that is related to international health. So the competency says that describe the activities of WHO. It is a knowledge level, and domain is knowledge and level is know-how. The question the mark is for 5 mark. The question what we asked was list the activities of the World Health Organization. There are some 5 or 6 activities they can list. Then describe briefly any 2 activities of the WHO. For listing 2 mark, and for explaining the any 2 activities briefly, that is for 3 marks. Next one is scenario based short answer question. The competency which we selected was 18.1. So here it is related to health advice given to the health person based on the international travelers. So in the scenario what we asked is, you have been posted as a medical officer to the screening, that is fever clinic at International Airport in Bangalore. So you are approached by a family having 65-year-old female and 5-year female child. The family is planning to travel to Ethiopia next week and return back to India next month and seek your advice regarding international health regulations. This is the scenario. So based on scenario, we're asking a question. Describe briefly the preventive and control measures as per to be taken by this family before, during, and after the travel. The question we asked for the 3 marks. Next slide, please. Okay. So scenario based MCQ. So here we try to address the competency of 20.2, which deals with the outbreak investigation. So we give the instruction also. Among the given options, choose the one best option. Okay, and the mark given for that is 1 mark. The scenario is Mr. X, age 68 years, traveled from Dubai to Bangalore on a flight yesterday and was informed that his co-passenger seated next to him was confirmed to have COVID-19. Before this information has reached him, he has traveled in a train from Bangalore to Mysore and by an auto rickshaw to his home. He lives along with his wife, aged 67 years, in a single bedroom house. Presently, Mr. X has no symptoms. What action do you like to take for this person now? The options: hospital isolation, home isolation, hospital quarantine, and home quarantine. So he has to choose a one best option. So if he choose the best, he or she choose the best one option, we can give the correct 1 mark. And this is the scenario based MCQ. And I thank you all of the facilitators and our group members for the wonderful presentation. Over to Maltesh.
Thank you, Dr. Tilak, for sharing those questions prepared by our team. So now we have a very brief activity which I shared in the WhatsApp group. We will just host one Kahoot quiz. It's just 3 questions, just to be a part of the what we are doing assessment. And these Kahoot or other apps can be used for formative assessment during the class also. That is what we are trying to do. And many of you might have used, few of you, if not used, this will be an experience how we use it for as a part of formative assessment. So I request all the participants to try clicking on the link shared in the WhatsApp group, that is kahoot.it. So it will lead you to a web page asking for a PIN number. I will share the PIN number now. Yes, the PIN number is 3767976. I repeat the website ID Kahoot KAHOOT.it. You can just type in Google. It will take you to the Kahoot.it for playing. You click on the pin, start joining. I have automatically assigned the nickname to save the time because typing in the name may again consume some time. So yes, good. I am able to see many of you are joining with different nicknames auto generated by the system. This is one very useful app which may help us to, in fact, like a clicker also, or assess formatively during the class or immediately after the class. So I will wait for 1 minute for participants to join, and then I will start the quiz. Once I start the quiz, the question is displayed in the screen which you are seeing here, and it will just show those green, red, or other colored options. You have to click on the options given over there. No options will be displayed in your Kahoot website, but it will be displayed in the screen which I am sharing. If you are joining from mobile, you need to switch between the apps probably.
Dr.
Yes.
Maltesh, just to interrupt, what is the game pin? Because it is showing 3767976.
Yes, ma'am. You have to just type in the number to
I know
join
that, but the number it says it is not
over here.
right. What is the number?
Same one, ma'am. 3767976.
Okay, I'll try
Does
again.
not exist.
Yeah, it's
I will
showing.
just check.
Does not recognize the pin. It says.
It is there.
Yes, ma'am. Please.
Okay,
Does
it's
not
come.
recognize. Can you refresh the page and revisit, ma'am?
Yes, after refreshing it came.
Okay, thank you. Yes, ma'am. Sometimes it needs refreshing. Okay, few more seconds. Then I will start the quiz. Of course, the questions framed are very preliminary. It's just for an experience rather than testing for the content. Only limitation I felt with Kahoot is it don't allow more members unless we are uh, purchasing it. Earlier, due to COVID-19, they allowed premium feature up to 2000 participants. Now they have removed that, and probably we may host only for 50 as a free. If we want to host more 100, 200, we need to purchase pro or premium versions. Yes, hope there are few participants. I will start the quiz so that you can yes, you will be able to. The first question, true or false. The question is here. If you are unable to switch the apps, I will read out the question. Logbook designed by the team heroes helps an Indian medical graduate to achieve the role of leader and team member. Please choose the option either true or false. Yes, the answer is true. I will move on to the next. So here we have few participants on the scoreboard scoring the highest marks. We'll go to the second question. Electives planned by the team heroes include option one, four options. I think it will be shuffled for different participants. Under 5 clinic and NCD clinic, NCD clinic and immunization clinic, school health service and immunization clinic, Indian Red Cross and NCD clinic. You can click on the options. I think options will be displayed just as a color coded with symbol. I have given just 30 seconds. We can decide the timing also. If the question is tough, we can allot more time. If the question is very easy, we can allot lesser time also in the grade of 10, 20, 30, like that. So we have the answers already here. So the correct answer, we presented Indian Red Cross and NCD clinic, which a student can choose. Again, we have now the participant's name will shuffle due to the speed which the participant responded and the correct answer which they chose. Next question, what level of competency is assessed by the scenario based MCQ designed by Team Heroes? Is it knows how, shows how, or shows? This is the last question. Just to experience it, we designed this and shared with you. Yes, the correct answer is knows how, because it requires the student to think over the scenario and then apply the learned knowledge to decide what level of preventive measure the person has to undergo now. So thank you for all the participants for participating. I think we have the podium here. We will have the best three. Of course, I do not know the names because it has been created as the nickname. The third place for Silver Fox and second for Excited Panda and the first one Mighty Hair. Anyway, I congratulate all the participants for taking it in a sportive manner. You might be already doing with your students just to feel an experience. We shared this. I thank all the participants for actively participating in the Kahoot quiz. So this is one sort of formative assessment which we can easily do.
Dr. Maltesh,
Thank you everyone.
those,
Over to
uh,
Dr. Parag. Yes, sir.
yes, Dr. Maltesh, those three people can reveal themselves in the
Yes.
WhatsApp group. We would be happy to cheer them.
Yeah, yes. Yes, true, sir. So we would like to unreveal yourself who have been placed under the nickname. I think you can post in the WhatsApp group. We can upload and congratulate you people. I will just move on to the next one where it will easily help us to view the entire report. Say we have 150 students or 250 students. The entire report will be just a very in fact a very interactive dashboard which they have how many persons answered correctly, what was the difficult question. In fact here it was just 3. If we have 10, 20, it will quickly help us identify where the problem was. We can conduct it prior to the class also to identify where the persons require more training. In fact, I thank Dr. Sanjay Bedi sir for having conducted and brought the resource person for conducting Kahoot based training. So I learned Kahoot in one of the course conducted by Dr. Sanjay Bedi sir. I'm using it. I'm not an expert. I'm just using it as a advanced beginner. Do we have the persons over here? Yes, Dr. Ankita ma'am as Silver Fox. Congratulations, madam. So, mighty hair is Dr. Anbhuti Kujur. Is one more person yet to reveal? Okay, I think first and third have revealed, second have yet to reveal. Okay, one more is Dr. Rachana. In fact, she is my wife in Group C. So I congratulate all the participants for, especially the winners as well as all the participants. I thank Dr. Parag and all the facilitators for allowing me to conduct this activity. Okay,
Thank you,
over to Dr. Parag, sir.
Thank you, Dr. Maltesh and the team. So we open it for the discussion now. I'll open up the questions. And, okay, so we have few questions then. Okay. So the first question is, Hemangini madam has uh, provided an answer from Dr. Chitra madam. Chitra madam has an opinion. How many of the community medicine teachers are competent in performing all that is expected of the interns? I believe this was asked early on in the presentation. So this probably refers to the workplace-based assessment of health education session of the interns. So Chitra madam is raising the concern that whether teachers themselves are competent in so many of the checklist items that we are intending to assess the student on. Uh, any response from the team on this?
Dr. Ankita ma'am.
Hello.
Would
Yes. Yeah. Since the question was asked whether we are competent, I think.
you like to respond for the question raised by Dr. Chitra ma'am?
Yes, sir. I'm speaking. Hello. Am I audible, sir?
Yes, you are audible.
Yes, sir. So there is no way that all of us will be
Yes, ma'am, you are audible.
competent in. Yeah. Madam, I thank you for this question. There is no way that all of us will be competent in each of these. That's why the overall scoring is 60% or more. And some of us might come on the farther end of the spectrum, scoring exceeding the expectations, but many of us, I am sure, if we have really sincerely worked as a community medicine person, we should be able to be getting anywhere between 8 14. I think 18 is the cutoff on a 32 scale 32 mark scale. So it is not only looking at whether they are competent or not, but whether some of us, I'm sure, will be on the further end and exceed our expectations, but most of us, I think 95 to 99% of us probably will fall in the spectrum where we are at least meeting the expectation. So if I hope I have answered that question. So we are not looking as it as a sort of a digital thing whether they pass or fail. So we are looking at whether they are competent enough to conduct a session. So I hope I've answered your question, ma'am. Thank you.
Okay. Thank you, Dr. Ankita. We have questions from Chitra madam. So madam has asked few more questions also. Another opinion from the madam is private health sector doctors expected to do inventory management?
Private. Hello, am I audible?
Yes, sir.
Yes, sir.
Yeah, this is in the private health sector. It depends on where the person is posted. It might not be a medical college always, and we are not grooming the students only to be a staff in a private medical college. They might end up being the medical officers. They might end up being in some NGO. It all depends on where they go and where they head later on. And we need to prepare our students to meet any challenges that are given to them in their future. And even in private medical colleges, like in my college, as assistant professors and even the associate professors, we go to the health centers on a rotation basis, and we do need to do this inventory management once in a while, or even as a supervisory visit we'll have to do it. So with these things in mind, even a private sector employee might have to do the inventory management depending on how it is in their setup.
Okay,
Just
thank
to
you,
add
Dr.
on, sir, I think, can I add on to that, sir?
Yes, yes.
Yeah, even the students passing out from the private institutes are made to nowadays do this 1 year compulsory rural service where they will be posted to PHC. At least they should be equipped enough to perform these activities. Probably Dr. Chitra ma'am has rightly questioned us whether this will be useful in future. If at all the person has to make an appropriate whatever roles we are expecting out of the IMG, he or she has to perform even in the private sector also. This is my opinion. So, I'm over to you, sir.
Thank you, Dr. Maltesh. When we were doing this presentation rehearsals within the group, and we came across this discussion, and we agreed that there could be difference of opinions. And we also went on discussing that if a particular department feels that this is a bit too much to expect from an undergraduate student, uh, and sometimes they might feel that it is fine to expect this from postgraduate students. So the questions that we probably need to ask ourselves is, are we providing this kind of learning opportunity to our postgraduates also, let alone this one? So those questions are also pertinent ones. But thank you, Chitra Madam, for raising those things. It's with discussion and questions that we will move forward. The next question is, in the view of severe human.
Parag,
Yes, Pankaj sir. Yes, sir.
sorry, otherwise I'll forget. That's why I sorry interrupted you.
Sure, sir.
Two things, a quick comment for this thing, and again, my personal opinion. First, really a good courage to the group who have tried live sessions during a live webinar with the internet and on and all, because that is always challenging. Always we like to have a PPT and finish it off in a live session rather than telling the people join and then have a live session. Really, for that, you need to have a good courage. Really good aspect on that. Now, coming to the first and second question related, I have only two issues to talk as my personal opinion. Number one is community medicine, or for that matter any educationist, they are very good in preparing checklists. They are very good in preparing templates after templates and after templates, and a book of templates and checklists can be released. But the most important aspect is implementation of that template. The template become as lengthy will become very difficult to fill, and finally it's going to be just a documentation exercise rather than using the template at every point of time. And when it comes to a workplace based assessment, the purpose is not to have extensive template, but the purpose is the learning or the objective achieved for the internship. And usually a workplace assessment will demand a lesser kind of a template and more kind of a activity, because it may not be possible at the right workplace. So when we are looking at the education aspect, we may think that intern will come out and one person will be associated, etc., etc. But in real life scenario, it may be difficult when the intern is really working. Second thing, many times we overload our medical officers also with so many things. We don't know the person is medical officer but preparing for a postgraduate or exam which needs to be cleared by him. So we need to keep all those things in mind when we look at the workplace based assessment, that it is more should be on learning or the objective aspect rather than too much overloading the system with the template and the checklist which we are very much fond of creating as an educationist. Second thing, regarding management of inventory, I don't know if some of you remember the example which I gave earlier. A few of our postgraduates were doing a postgraduate exercise, and they all joined to another college and they made all those postgraduate exercises undergraduate, and people, they were happy there, saying that really my students are doing well at an undergraduate level. They are knowing the postgraduate exercises. But also we have to come to the basic concept. Really undergraduate needs to know that. If that is a part of the important competency, if as an educationist or as a professional I feel then we should not demarcate as a UG or PG. That is very, very important, rather than because all colleges will have a different pattern. Madam brought about different institutions, will they have to do this kind of thing? But if it competencies have to be achieved, irrespective of the designation, irrespective of the government, private, or any kind of institution, that has to be achieved. And third important thing, when we develop these kind of competencies which are exhaustive in nature, we need to understand that each and every student has to move through that. If we are not able to make that, then unless again the purpose will be lost. Parag, am I audible?
Yes, yes, sir. Yes, sir.
Yeah, okay, thank you. Just quick, sorry to interrupt you. Otherwise, I will forget when we go to the next one.
Thank you, sir, for reminding. Yes, so since there are a few more questions as well, but if I can bring in other facilitators also, if someone wants to elaborate this in more detail, or any other point for the presentation up till now.
I had a query. Can I bring it in?
Yes, madam. Yes, madam.
Yeah. Regarding the scoring that we mentioned in the beginning, I just wanted to know, would the faculty be disclosing the grading system to the interns as to how the points are going to be allotted to them for doing certain things? Like they said, if they translate it, they'll get more points. If they don't, that part like that. So I suppose they'll be informed.
Yes, ma'am. In fact, when we had this discussion, am I audible?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Ma'am, actually, when we were discussing this, we were thinking of starting to, because health education is something that they start in their first year. So if we can slowly, customize this, culture them to, this sort of assessment, that these are the things that we are looking for in their presentation in a health education session. Probably by the time they are interns, they will know for sure that these are the things that I need to do best, and if I have to exceed or at least meet the competency, to be meeting the expectations of the competency. So probably priming them early on, when they are doing it in a simulated, because that's what we mentioned as prerequisites. If in a simulated environment, this is what we are going to be teaching them, that this is how we are going to assess you, not only now, even when you are an intern. I think that will go in a long way to make them understand that they are going to be assessed, and these are the points that they are going to be assessed on. I hope I have answered.
So what you're
Yeah.
trying to say is they would have been knowing this thing right in the
Yes,
beginning
when
as
they're doing it
undergraduate
in
students.
the, yes, ma'am. Yes, ma'am. So the couple of competencies that I mentioned earlier was doing all of this, actually providing health education in a simulated environment and all would be there earlier. So if we have this checklist early on, say that when they're in second year, when they're going for their field visits, or this one, when they are expected to do a health education session, may not be only for an individual or for a family or in the community in general or in the hospital settings. That time, if you're going to prime them, saying that these are the things, your ability to conduct a session, your communication skills are important, your organization skills are important, and these are the parameters that you're going to be tested on. I think they will be primed by the time they are groomed to be interns. So I hope I have
Okay,
answered your
but
question, ma'am. Yeah.
is there any
Yes, ma'am.
harm in telling them again?
There is no harm in telling them. In fact, I would prefer if you tell them that these are the things, again reiterate and say that these are the things that we are
Yes.
going to this one, so that they will also be vigilant, that I have to engage them, I have to ask them question, I have to so that sort of ingrains some sort of sort of a tempo in them only when they are presenting their health education material. So
Ankita,
that
ma'am, if
also
you
will,
can,
yes, yes, sir.
Ankita, if I can interject, we
Yes,
completely
sir.
get your point. I believe what Hemangini madam wants to bring to forth is that sometimes the teachers have this sense that the checklist that they have prepared is kind of a secret checklist with they should not reveal to the students, which is not the case. in an ideal education setting.
Yeah,
Yes, so we all of us agree that this should be shared with the student so that the student knows on what parameters he or she is going to be assessed on. I guess that's the point that Hemangini madam is making, and all of us are in agreement for that.
Yes, I
yes,
think
sir.
so. Yeah.
Thank you, Hemangini ma'am. Anyone else from among the facilitators? Okay. So then Chitra madam has also mentioned two more points about implementation issues, and then okay. So Pankaj sir has also mentioned quite elaborately about the checklist, and Ankita madam has also mentioned that. So what, in conclusion, maybe what I can conclude is that uh, as a workplace-based assessment tool, this looks to be more elaborate than what we can practically or feasibly implement. So as Dr. Ankita madam also mentioned that many components or parts of this checklist can go early, maybe as kind of as something kind OSCE kind of a thing or something of that sort to be used early on. And then what we can possibly use in an internship would be a relatively short, very shorter version of this. So I agree that for a real workplace-based assessment tool to be more practical, it needs to be shorter than this. The reason why we continue to show this is that the other I mean the components the team had thought through in taking a little great elaborate effort. So I just did not want to waste that effort and show that. So I agree that many components can be taken as an OSCE station, and the actual workplace-based tool would be a little bit shorter than this, so that it's feasible to implement. So with that, another question is from Chitra madam on the question that was framed. Probably it was an MCQ. Is family planning to go to Ethiopia next week? Why will they go to airport health officer for a consultation? If Tilak sir can answer that.
I agree, madam. There was maybe little bit we over thought about it. I think we could have written as a healthcare medical officer, local medical officer also would have written. It would have been better.
Okay. So we take that.
And one more thing. I think since international rules will be more aware by the medical officer of the airport. In that way, also we might have thought that at a time. That's what I am thinking.
Okay. So
Parag, can I come for 1 minute?
Yes, sir. Yes.
Can I just see the slide of that LAQ and short question just for a second? Okay. Again, to say that which I keep repeatedly, please take this as a friendly discussion among all of us. Just look at the student perspective. Suppose I am the student. I just realize, okay, there is some case scenario. As like a student, I will never read the case scenario first. I'll read the question first. And that is also taught in the school. Read the question first, read the comprehension, then again come back to the question and answer. So if I read the question, what is the importance of planning? Describe your plan of action using planning cycle. What is cost benefit and cost effective analysis? In this scenario, even if I don't read the scenario, I can still write the answer as a student. I'm looking at pure at the student perspective. And that's why repeatedly in earlier talks also, I used to keep saying, make sure the scenario, the effort which is put for writing those scenarios should be used in the question answer pattern. Can we go to the next slide, please? Parag, am I audible?
Yes, sir. Yes, sir.
Can we go to the next slide, please?
Yes, sir. The slides
Please click on the slide and then do next. Yes.
Next slide, sir.
No. Before that.
Yes. Sir.
Yeah. Now again, see, wonderfully you created one scenario. That. No. Before that.
That one, the airport one.
This one. Yes.
Now see, wonderfully you wrote.
Yes,
you made a lot of efforts in writing. But again, as a stupid student who wants only marks and somehow get a passing mark at the end, what I will do, I'll not waste my time in the scenario. I'll just read the last line. Describe briefly the preventive and control measure as per IHR to be taken by this family before, during and after travel. I just see screening for fever clinic and I'll start writing. Probably again here, though is a short question, we can involve the case scenario more in that way, so that more amount of reading. We have to go back to our English classes, where unless we read the comprehension properly, we could not answer. This is the only way we can improve the intellectual skills or cognitive skills, and to ultimate aim a decision making skills when the same kind of scenario happens in a real life. And again, to repeat, that is a friendly discussion. Please take it positively, just to come out with the better questions for our students in future. Thank you. Any difference of opinion will be most welcome if we can come out by a presenter, faculty, or my friends.
Very true, sir. Well taken. I think we have to rethink and redesign the questions based upon the scenario. So, because without reading scenario, also sometimes students do write the answers whichever comes to their mind. So, true.
Extending what Pankaj sir mentioned, I believe this is a logical or possible next step when any faculty member tries preparing a scenario-based MCQs. This stage is at the middle, where the MCQ question would not be perfect. It would be imperfect and it can be improvised. But I would really appreciate someone doing this, because unless we pass through this stage, we will not land up at perfection. So this would happen, and once we prepare such kind of an MCQs and be bold enough to share it with peers for the possible validation, then only we'll be able to reach to the stage of nearly perfect MCQs. So yes, it surely has scope for
Parag,
improvement. Yes, sir.
sorry. Please go ahead.
Yes, sir. So just I was concluding that surely it has scope for improvement, and we appreciate whatever. I mean, we appreciate the effort.
Parag, can I take few seconds more if it's okay with you? Just few
Yes, sir.
seconds. On this question, it is, as Parag said, is a really great effort to have these kind of questions, but only two concern in this question. Number one is, I should know that COVID guidelines are changing over a period of time. The questions are prepared at one point of time and implemented at some other point of time. The guidelines should remain the same, because it's largely through fast evolving science. That is number one we should keep in mind. But a very good attempt to take a COVID question. Second thing, I'm a student. I'm again a stupid student. I should know what is isolation, what is quarantine. My question answer will become like a KBC 50-50. And then it will be probably easy to answer.
Yes, sir. Yes, sir. We also faced the same thing when we put COVID questions in our formative assessment this year. When I look back at those scenario-based MCQs, uh, the answers which we presume to be correct answers back then, 4 months back, are no more correct answers. Thank you for that, sir.
Hello.
Yes, Manjunath, sir.
Good evening, Parag sir, and good evening all. After listening to this wonderful discourse, I just want to summarize from my side. So it has boiled down to, the discussion has boiled down to ambitiousness versus caution, or enthusiasm versus experience. In my words, I use, it is Macbeth versus Hamlet. Macbeth was always ambitious, Hamlet was always cautious, to be or not to be. But I personally feel, whenever you want to do a change, especially change an entire paradigm, we need to be ambitious also. We need to be ambitious also. So, but at the same time, you need to be cautious also. There should be a trade-off and optimization. And CBME implementation definitely requires a lot of ambitiousness also. So the checks and balances need to be built in, as the experience of Pankaj sir has rightly brought in. And I would just say in one sentence, what I felt going through the presentation is, recently we lost Diego Maradona, one of the greatest player ever, arguably greatest in the football. And this presentation is equal to the goal he scored in 1986 World Cup against England, which is also called as the hand of God goal. And I feel Maltese sir and et al. made it a teaching session rather than a presentation session. I learned a lot, thoroughly enjoyed, and I thank the heroes. You are actually, you deserve to be called as heroes. And I would go one step further and say you are guardians of community medicine because you have gone many notches higher to bring in so many new things into this. Of course, these discussions, getting, teasing, discussion, dissecting out these the intricacies will always be there. Even if it is prepared by the best of the best, this can always be dissected out and we can improvise. So that is always there. Just few more seconds I will take on Chitra madam's question. So this is the question, the billion-dollar question which needs to be answered. Madam asks, are the community medicine faculty competent enough to do all these things? And Madam herself is an example. With all her experience and expertise and all, she is still involved in this program actively. That shows that that is the attitude which is required. As we know, there are four stages of competence: unconscious incompetence, conscious incompetence, conscious competence, unconscious competence. And there is a phenomenon known as Dunning-Kruger phenomenon also. So that is unconscious incompetence stage. So I will ask another question, adding to Madam's question. How many people, faculty are really interested in teaching CBME? And if we conclude that more than 95% of faculty are interested, then incompetence does not matter. In a matter of time, people like Maltesh Shundi sir will teach us how to become competent. They may be in the Dreyfus scale, some are low, some are advanced beginners, some are already competent, some may be experts in CBME. But definitely we will travel that path and we will all become competent over a period of time. And I also feel strongly that optimism is also very important. This launching CBME on without piloting itself is ambitious. So I will stop here. Thank you very much for giving me the time. Thank you, sir. Over to you.
Thank you,
Thank you
Manjunath,
very
sir.
much, sir.
Sir, you have made my job easier, and you have perfectly summarized and concluded the session. I'll wait if there are any more questions. There was one more question by Jyoti madam on this, and I believe Manjunath sir has answered that question also. Let me see if there are any other questions, and any other faculty member facilitator wants to come in. I'll wait.
Yeah, Dr. Parag Samdatta here.
Yes, madam.
Yeah, so I liked and I want to congratulate also the group for presenting the elective part. The assignment of elective, this we saw actually here as a new assignment which was presented, and enjoyed that really. So my question actually was about the objectives, basically, like what for the NCD clinic, I think, like what the group had framed. Can you see the yeah? So like, are we really like planning the students actually like they should be able to counsel? They should be able to screen people for NCDs with this elective posting, because they are MBBS undergraduate students. So because for one thing, like I see like inventory management is under supervision, but other things will they be doing independently, or how we want them to do that?
The team.
Dr. Mitasha ma'am, would you like to take the question? Okay, I would take the question. I think, Madam S, you have raised a pertinent question related to NCD clinic, where usually it is manned by the medical officer and other staff. I think we have to reframe just the learning objective under supervision only, because we cannot let the students screen without supervision for the NCDs, which they may not be adequately trained and equipped with. But having said, the other perspective is, what I have seen in the PHC and other settings, where we are training ASHA and the frontline workers to screen NCD, it may not take much efforts to train our own students and interns for screening the NCDs. But having said, under supervision would definitely add value and less harm to the individuals over there. Thanks for that question, ma'am. This is my perspective. Others may join me to answer or discuss the question raised by madam.
Yeah, thanks, Dr. Maltese, for answering that. Because my query actually was that with the healthcare workers, health workers with ASHA, Anganwadi
Yes, ma'am.
worker, I know that we reach actually to a certain point. Like same thing, like
Yes.
yeah. So like at up to which level basically like we want them to use actually for this work, whether we will be using them as a manpower or whether actually this will be like their way actually a methodology for teaching or like giving them that experience. Somehow that actually has to come somewhere. That's all. Thanks.
Yes, ma'am. Thanks for that question, which is actually a food for thought. To what level we expect from our students? Thank you.
Thank you, Dr. Somdatta. To me, I believe if not a full-fledged MBBS doctor, what we expect from a paramedical person just above ASHA, I guess we can expect from third MBBS, a student who has completed third MBBS Part 1. And yes, I agree that we may not see them as a health workforce then, because the numbers would be less in one particular elective. So that clarity should also go to the college institute as well as the place where they are posted. That the purpose is for education and training of these students rather than seeing them as adding to the workforce at the center. Okay, so anything else, because the time is running. Okay, so since there are no more questions, I guess we had good discussion on this. Thank you to Team Heroes for the wonderful presentation. And with that, Manjunath sir has also beautifully concluded the discussion. So we end the session here then. Thank you all.
Thank you, sirs and
Thank
madam.
you.
Thank you, everyone.
Thank you.
Thank you.
Thank
Thank
you.
you all.